Hi, and welcome to another episode of Hot Takes with me, the Silver Fox. And when people look down that extensive list of SNP failures, you can understand why there is much wailing and gnashing of teeth. But not for much longer, it seems. There are plans afoot to move dental checkups from 6 months to 2 years, and thus to find anyone with teeth will be a rare thing indeed. See what I did there? Well, this of course was designed to save money, but it will do no such thing, because without regular preventative dental care, it means the problems when they are found will be much worse, and therefore much more expensive to fix. Now, of course, this doesn't apply to the elite at the top of the SNP. They've all got their private dentistry plans paid for by you. However, those at the bottom of the social ladder, they will suffer. They will be very lucky indeed if they can even find an NHS dentist. Certainly if anything like round where I live is the case. It's very few and far between. And so they will either have to rely upon going private, which most won't be able to afford, or let's just say, let's do some homemade dentistry with a pair of pliers and getting a mate to yank a tooth out. Oftentimes, this will involve going to hospital afterwards. And so you have to wonder why they're doing it. Well, I suppose ultimately, if they can spread a bit more pain and misery, that's exactly what they're going to do. Let's have a look at this. So, SNP condemned over crisis in dentistry as checkups moved from 6 months to 2 years. And the Scottish Government has been blasted by Scottish Labour for presiding over an oral crisis, make your own gags up folks, in Scotland, as thousands more in agony Scots call up NHS 24 for advice instead of seeing a dentist. Well, this is the thing. Firstly, there aren't enough dentists. And secondly, even if there is one, try getting in to see him. I mean, I a couple of months ago had a massive pain. I mean, Sunday night, excruciating pain. I wanted to take my jaw off. It was that bad. Anyway, I went to the dentist. I'm so lucky. I've got a private dentist now. I could pay. But if you haven't, I don't know what you're going to do. But that's the whole point of this story. Went there. I just said, pull the bloody tooth out. And she said, no. And she drilled down. It was the back tooth. She got the two roots. And she gave me 2 root canals. I mean, I was in agony while she was doing it. I thought she was drilling for oil. But the point is now, I'm sitting there, still got the tooth in my head. Fine, no pain, marvellous. At the time, I'd have just put pliers in and pulled it out. And this is the thing. I was fortunate I've got access to a dentist. If people don't, they are going to pull their teeth out with pliers. And then they're going to have to go to the hospital. And it's going to be pretty bad. And so, by cutting back on dentistry, you're going to create a lot of problems. Anyway, the SNP has been accused of presiding over a crisis within dentistry after shock new figures revealed that Scots are being forced to call NHS 24 about teething problems. And instead of helping to improve this, ministers have decided to push back checkup times from 6 months to between 1 year and 2 years. Like I say, in an emergency, people ain't going to wait. They're just going to yank it out with pliers, aren't they? It's led to Scottish Labour labelling this move dangerous goalpost shifting, which is being done to cover up oral health disaster waiting to happen across the country. They pointed to eye-watering statistics that show thousands of patients are waiting longer than ever on the NHS for treatment. Here's another thing, and people are often very unaware of this. Oral hygiene, and especially oral health in terms of infections in teeth and things like that, very important. There is scientific evidence and even sort of scientific proof that when you have oral infections going into your mouth and things like that, it can end up killing you, as in heart. It can give you heart infections and things like that. It can cause heart trauma, breathing problems, all sorts of other things that are getting in. And so oral hygiene and having teeth looked after and make sure they're clean, make sure they're this there and there's no infection, or there's no route to infection through having cracks and dental caries, rotten teeth and things like that. Bad teeth can give you a heart attack. And so oral hygiene, very important. And so by moving this from a 6 months to a 2 year, you're going to increase deaths from other causes as well. So that if they don't know that, then that's down to not doing their research. And if they do know that and are deliberately doing it, that's criminal. Anyway, there were more than 850,000 fewer dental claims in the first half of 2023 compared to the same point in 2019, meaning fewer people, they say less people, it's fewer people, are getting treatment. But calls to NHS 24 have soared from 25,500 in 18-19 to a shocking 67,000 last year. Waits for dental surgery at Scotland's 7 main health boards have also increased massively during the same time frame. Despite this, the SNP government has decided to move the standard time between checkups from 6 months to maybe 2 years, with Labour claiming that this is no more than a desperate attempt to shift the goalposts and massage the figures. And it will damage people. Apart from all the extra cost involved in trying to fix the things that should have been fixed cheaper and easier, you've got people sitting there in absolute agony for longer, pain in longer, like I say, self-administered, pulling extractions of teeth, then possible infections, possible deaths from those infections. There's all sorts of problems. But they don't care. They literally do not care. Because everything's got to be about saving money so they can spend it on glossy independence brochures, rather than paying for a few dentists to try and shorten the waiting lists. Now, and then the other thing. Now, I've got another tangent, very quick one. My father-in-law, Scottish, many of you know, he's from Greenock. When he was 21, he had all his teeth taken out. Now, apparently, and he's in his 70s, he's 75, 76 or something now. So he's well into his 70s now. He said, but apparently, back then, when he was 21, so 50-odd years ago, so you're talking, what? Early 70s, late 60s, early 70s, something like that. But apparently it was a very common thing. You hit 21 and you had all your teeth pulled out. He said it was a very Scottish thing. He said, and then they started treating them and it wasn't anymore. Well, I think the way it's going, it may well be a Scottish thing again. I mean, literally there was nothing wrong with his teeth, but they just pulled them all out and gave him the dentures so that he would never have toothache again. It seems a weird thing. It's like saying, oh, well, let me cut your arms off so you don't get a sprained wrist. It's ridiculous, isn't it? I mean, mine are Romeo. Well, apart from I've got a crown and a bridge. But other than that, they're Romeo. And it's like, why wouldn't you try and keep the teeth in your head? But apparently, yeah, apparently it was a Scottish thing. And I'm sure older people watching this will probably know. It's a Northern Irish thing as well. Pulling your teeth, apparently. But just keep the teeth in your head. Don't keep pulling them out. But that's what's going to happen now. Every time, if you can't get to a dentist, I'll just pull the bloody thing out. Get a mate, yeah, pull it out. And there'll be someone sitting there with an dirty old pair of pliers, yanking the bloody thing out. Infection going in, and you're in hospital. Dead. Anyway, Paul Sweeney. Paul Sweeney said, dental care in Scotland is deep in crisis, with thousands going without care and those with the funds being pushed into the hands of private practice. And of course, that's what the dentists like, money. Faced with the crisis, the SNP has decided to shift the goalposts in a desperate attempt to massage the figures. Have I not just read that? No, it's just they've done the same line again. Never mind. All this will do is increase the risk of poor oral health and increase health inequality. And by increasing the time between checkups, he says, we will all see people presenting later and with more serious issues, which I did say at the beginning. And it does need to be improved. Oral health is massively important. In terms of regional figures, the highest increase was at NHS in Lanarkshire. There was 780% increase in the number of weeks patients had to wait. 780% increase is shameful. It was going from a 5-week wait in 2019-20 to 44-week wait. That's getting on for a year to see a dentist. Let me tell you, I wouldn't be sitting with that agony that I was in the other day. No kidding, tramadol. It was the only thing that got me. Aspirin didn't work. Like I say, none of them worked. Tramadol, the only thing, got me through it. Anyway, this ongoing dentistry crisis also flies in the face of the SNP's frequent boasts, or as we like to call their boasts, bullshit, about offering free NHS dental care for everyone who's under 26, as many have to wait for months to even access this. Hundreds of Scots are even being forced to fork out to go private in order to get urgent treatment. They should make dentistry in Scotland free. Why not? Why not do the let's have free dentistry in Scotland line? Because everything else in Scotland's free. That should be the SNP's boast. Free dentistry for all. Woo! Never going to happen, is it? Never going to happen. They're all full of it. Absolutely. Why draw the line at 26? That's a very sort of arbitrary line. Why not 36, 56, 76? Old people need teeth. Anyway, a Scottish Government spokesman said nobody will have reduced access to dental examinations if they need them. Bullshit, they just said they're doing it. Under the new system, alongside provision of an extended exam every 12 months, not 6, it should be 12, dentists can use their clinical discretion to recommend shorter recall frequencies if this is appropriate based on their assessment of patients' oral health. Load of crap, isn't it? Official statistics show that since the start of the COVID pandemic, there's been a significant improving picture in NHS dentistry. Well, that's what they're saying. That's what the SNP is saying. But it's not what the facts are saying. It's not what the official government figures are saying. It's not what the NHS is saying. So who are you going to believe? The people at the pointy end of dentistry or the SNP bullshit merchants who want to make everything in the garden look extremely rosy? Well, I know who I believe. And it isn't the SNP. Anyway, I'm going to come up, round off, and I shall smile with my own teeth. I don't think that maybe, now this may just be speculation on my part, but perhaps maybe, that the NHS is being deliberately run down and things are being pushed to private on purpose by the SNP, and that they all own shares in private dentistry plans. And of course, the more people that go on, the more money they make. That wouldn't surprise me. I'm not saying it's true. I've got no evidence for it. I'm just saying that given the sort of past history and what we think of the SNP, that really, really wouldn't surprise me. It'd be in their interest to utterly destroy NHS dentistry if they own shares in private dentist, practices. What do we think? They certainly seem to have no concern over people's health. And as I said at the beginning, dentistry, oral health can actually kill people. Bad oral health can give you heart attacks. Anyway, another one to grind your teeth over. Everything gets worse and worse for them, doesn't it? There's no respite from it. Anyway, thank you very much for listening. I hope this has enlightened you somewhat. And do take care. Floss. Always floss. Till next time, stay safe, stay well, and always pack your toothbrush. Bye.